This is DW News Africa. Coming up on this special edition of the program, Africa's blood deserts, how to tackle the continent's donation crisis and save lives. Nigeria is among the countries in most desperate need of more donors. It currently only meets 30% of its blood demand, with cultural myths about donating blood partly to blame. We'll look at efforts to change that and meet some donation heroes.
Whenever I have the chance, I'm very willing to donate blood. And of course, the top priority is to save a life out there. Sometimes I donate like 4 times in a year. Yes, sometimes about 4 times in a year. And other times maybe 2 or 3 times, like that.
I'm Michael Oku. Welcome to the program. Why don't Africans like donating blood? There is high demand on the continent for it, but the supply often falls short of what's needed. World Health Organization figures say that on average, African countries currently collect only 5.2 units of blood for every 1,000 people. Compare that with high-income countries, which see 31.5 units per 1,000. The WHO recommends that 80% of each country's total blood supply come from voluntary unpaid donations. But think about this. Only 18 of 47 African countries have reached that target. Take Nigeria, where the National Blood Service Agency is warning the country only covers roughly 30% of its blood needs. There are many reasons for donations, but some of the most critical include severe anemia, which is often caused by malaria, childbirth complications. Mothers may bleed during childbirth and need a transfusion. Accidents and trauma. For example, victims of road accidents often need blood. The illness, sickle cell disease, is widespread in Nigeria, and many sufferers need regular transfusions. And of course, surgical procedures. Patients in surgery need to replace lost blood. So with such an urgent need, why are so many Nigerians reluctant to donate their blood? Well, health experts say cultural myths, even including associations with vampirism, are partly having an impact. More on that coming up. But first, DW's Olisa Chukwuma looks at how the government is trying to get more people to give blood.
A patient receives a life-saving blood transfusion at this major hospital in Lagos. Many who come to the emergency room urgently need blood, but there is not enough to go around because there is a nationwide shortage of donated blood in Nigeria.
People do not really want to donate the blood, not because they don't have adequate units of blood in them, but because they are not well educated about the people that need the blood, where this blood can be donated, how this blood can be donated. There are also a lot of myths and cultural beliefs concerning blood donation that also affects the donation rate.
Despite a population of 200 million, just a small fraction of Nigerians donate blood. Only about 500,000 units of blood are collected each year, less than 30% of WHO standards. Religious beliefs, fear of falling ill, and apathy turn many people off from the idea of blood donation.
I haven't donated blood before, and the reason is because I don't have much blood in my body. And my blood is also hard to find, so I don't donate blood.
I've not donated blood before, and I don't have any reason to donate because I don't have a wife in the hospital, neither do I have any family that was sick that I need to donate for.
Nigeria's government is trying to change attitudes around voluntary blood donation and has recently ramped up its campaign of outreach programs and mobile donation centers. Often, it's people with friends and family in need who decide to donate. Henry has donated since 2019 after a close friend had an emergency.
So whenever I have the chance, I'm very willing to donate blood. And of course, the top priority is to save a life out there. Sometimes I donate like 4 times in a year. Yes, sometimes about 4 times in a year. And other times maybe 2 or 3 times, like that.
To reach the levels of blood reserves that Nigeria requires, around 2 million people need to start donating blood annually. The staff here try to make the process as comfortable as possible, with counseling before and after for donors.
Apart from the slight pinch I felt when the needle went in, it's pretty much an easy process. The average blood donation takes between 5 to 10 minutes, and I feel pretty normal.
Making blood donation something that's normal in Nigeria would give medical workers the tools they need to better save lives.
And you saw him in that report donating blood, DW's very own Olisa Chukwuma. Olisa, you said it was your first time and you felt okay. Did you have any problems at all?
Well, no problems at all with the donation. It's apart from the slight pinch when the needle goes in, it was pretty much a simple process.
And how are you feeling now?
Very good, very good. It was my very first time of donating blood. Obviously, I had a bit of, maybe say hesitation, but with the team and the counseling that you get pre-donation, so you have counseling before you donate and after you donate, where you have to fill forms and they ask you certain questions. They check your weight, they check your blood counts, they even check your height to make sure that you're healthy and fit enough to donate. And which it turns out I was quite a healthy one with lots of blood to give.
Give a sense to our viewers, particularly those in Africa and in Nigeria specifically, how easy it was.
Well, it's relatively easy, especially if you don't really have any preconception or fears about donating blood. You walk in, you say you want to donate blood, they ask you certain questions, you fill a form, and you go through, stage upon stage of counseling before you eventually go into the section where you then get to get the needle into your hands, into your body, and you get to donate blood. And after that, you even get another counseling, post-donation counseling, before they let you go. So it's all in all, the process will take 30 minutes, pretty easy.
Well, you look well. Will you be doing it again at some point in the future?
Well, certainly, because you look at the counts of where we are right now in Nigeria, in Africa, the voluntary blood donation is quite low. You have some people who are regular blood donations that might donate up to 4 times. But if we have more people, healthy people, whether male or female, going out to donate multiple times, because don't forget, Nigeria has the highest population in Africa. So, which means we need at least, more than 20 million people donating yearly. That will really improve, the blood bank, the blood counts that we have, and the blood supply. So I'll be doing it again for sure.
I may not be overstating it to say you are a lifesaver. DW's Olisa Chukwuma.
Thank you.
And for more, we have invited Dr. Bodun Ojukwumaya. She is a hematologist with Lagos Blood Service and the executive secretary of the Lagos State Blood Transfusion Service. Dr. Ojukwumaya, welcome to DW News Africa.
Thank you very much for having me today.
It's our pleasure. I'm going to start with the first obvious question. Why aren't Nigerians donating blood?
Well, we don't have a culture of blood donation in Nigeria. We really do not know why people should donate blood, who needs the blood, and what the blood will be used for. So because many of us, while growing up, nobody really talked about blood donation, it is quite difficult now that you're of age to be able to donate blood. So there really is a very poor culture for blood donation. Apart from that, blood donation is related to a lot of myths and lies, a lot of falsehood. So people are scared because of those myths. So we have to try to tell people the truth, give them the facts, and demystify those news that they have. So it's all about poor blood donation culture, as well as the myths and falsehoods surrounding the activity and the life-saving act of blood donation.
I want to talk more about those myths in a moment, but I have to say that the first time I saw you, you were on a radio show where the host felt the need to ask, what does it mean to donate blood? And he made a reference to vampires, only partly in jest, I think. I was struck by how fundamentally some people might not understand the basic idea of giving blood.
Yes, you're right. So people just believe that the blood that we collect, we use it for all sorts. And so they call us the vampires. In a way, it looks really off to be called a vampire, but we try to see the fun out of it. I told someone that vampires look young and they are strong. So if you donate blood, you will your blood will be as your bone marrow will give you new blood cells, so you will look younger. And also those cells will make you stronger. So in a way, they relate the people that collect this blood. That's the phlebotomists, the technicians, the scientists, people that work in the blood transfusion service. They attach the word vampire as well. So we just bring out the fun out of it. Yes, we're vampires. It's for a good cause. And when we take this blood, you benefit. Instead of the vampires being stronger, it's the people that give the blood to the vampires that are stronger, that have positive attributes related to it, that have free blood tests, and that have all those positive research attributes like a reduced incidence of having cancers, reduced risks of having cancers, reduced risks of having things like cardiac diseases. So we are vampires. They have all the benefits that the vampires have.
Well, I hope people are listening to you right now. I understand there's a thriving commercial market in blood for individuals who might need frequent transfusions. To what extent is selling blood for profit disrupting efforts to give it away for free?
Really, it's like a weighing balance. One is more, the other reduces. That is it. So the more the commercial donation, the less the voluntary blood donation. So that is why the Lagos State Blood Transfusion Service, as well as our related stakeholders, like the Red Cross, Nigerian Red Cross, we have NGOs like IMA Health, the Leukemia Foundations, work together to increase the advocacy and to increase our own drive to convert both the replacement donors and commercial donors to voluntary blood donors. So many commercial donors will say they do it because of the economic situation in Nigeria. Things are quite tough for a lot of people. It's quite difficult to be able to afford the things you used to be able to afford. So many of them hide under that guise. So for people that say that they want money because they want to buy food, we give them the alternative. Why don't we give you this food? You know, if you want money for food, we can give you the food. Some of them will tell you that, oh, transportation is expensive. Now we want money for it. And we offer them, okay, if you want money for transportation, then give us the proof that you had this transportation. We will refund you. So truly, there is a commercial market for blood. But one of the things the Lagos State Blood Transfusion Service has done is to reach out to those commercial blood banks. And they are actually private blood banks. And then we tell them to register with the Lagos State Blood Transfusion Service. We need to see what they are doing it and how they are doing it. All of them are registered. Right now, we have over 120 private blood banks that are registered with us. Some of them are within hospitals. Some of them are standalone. So what we do, we talk to them, we train them, we do external quality assurance assessments for them, and we give them targets. See, once we see their records, we ask them why they are being paid for this blood. You don't need to pay for it. If they have come and they need money, ask them the reason why. And those that have justifiable reasons are the first ones we convert to voluntary blood donors.
We should make it clear there are two models of giving blood: voluntary donation, where people give their blood for free, and commercial donors who sell their blood to private registered firms. Give us a brief description of how that works in Lagos.
So first of all, we have three sets of donors. We have the voluntary blood donors who give their blood for free. They don't know who wants the blood. They don't know who they are giving it to. They're just doing it to save life. It's out of an altruistic need that they give their blood. But we have the replacement donors. These are people that give blood for a relative, for a friend. Maybe their friend or relative has a medical condition that needs a blood transfusion to keep them alive. So some of these ones donate for those, they're called the replacement, family replacement donors. And there is this set of people that are not approved. We do not like them. We do not want them, but they do exist. Those are the commercial donors. These ones give blood for money or for gifts. So these are the ones that we try to target, and they are the ones that we try to change. You give them a change mindset. Please, you don't need, you can get money for any other reason, but not for blood, which is given to you freely by God and should be given to others freely to save lives.
You co-wrote a paper suggesting Nigerians are more likely to donate to their kin than to strangers. That's a completely different model to, say, here in Europe, where most donation is completely to strangers. Do we know why that is?
So, because we have a poor culture, I told you that there's a poor culture for donation of blood. And I also mentioned that there are lots of myths. Some of these myths are that the blood could be used for fetish reasons. Some people believe that when you give your blood out, that all your future blessings, is given to the person that gets transfused with the blood. And some people believe that the blood that you give will make them sick on the long run. And so there are so many myths that are really funny and unbelievable. So even voluntary donors and replacement donors, they want to be sure that the blood is used for the right thing. And that is where the kith and kin part comes in. They want to give it freely, but they want to be sure that even though it is given freely, it is given to people that they trust or people that they know. And it happens a lot here. Quite a lot of people will give their blood, but they also want to know that wherever this blood is being donated to, or who is going to receive the blood, is someone that they are sure would not use their blood for wrong reasons.
Doctor, I think somebody listening to this for the first time might wonder, where do these myths come from? They're quite surprising, I think, to most people who might be outside of the culture. Can you give us some idea of why they arose in the first place and where they come from?
So we are in an African community that really those myths would have come up from way before I was born. I really grew up to hear about them from donors, and I know that they have existed long before, years, decades ago. Most of the time, myths arise from poor experiences of people. That is why myths arise. It's possible that something has happened to a donor in the past. For example, let's give donor reactions. If a donor is not well assessed and does not answer the eligibility questionnaire and donates blood, there's a possibility that the donor can have a donor reaction and may feel faint. That is a vasovagal reaction. It is possible. If a donor had such a bad experience, then donor will spread rumors or will spread those myths that if you donate blood, you could die, or you could be unconscious, or you could faint. That is because something was not well done. And that is how a myth will propagate. So another myth could be, it's possible somebody was a regular blood donor and suddenly got married and found out that he's unable to give birth for whatever reason, must have had a medical condition that would affect his or her fertility. And we'll just wake up and say, okay, I donate blood all the time. It's possible that this is the reason why I'm having this particular condition. So myths usually arise when it's related to an experience from whosoever starts the myth. So many people have different experiences. Before now,
Right.
blood donation used to be crude. We have evolved over time. The donor assessment was not as good as now. The way blood was collected was not as good as now. Now we have point of care tests like the hemoglobinometer, where you can check for the hemoglobin levels within a few seconds, and you know if you're eligible to donate blood or not. And before then, people used to use just copper sulfate, which you still use, but the copper sulfate might not have been well validated if it is doing the right thing. So there were different ways where blood was called out in assessing people for blood collection, which might not have been the right thing to do. So really, myths and falsehood around blood is usually related to experiences of people in the past.
Understood.
And that is why we are here, to also change all those, to let them know that things have changed.
And Doctor, as if the problem wasn't already bad enough, we understand that since COVID, the already slow stream of blood donations has been erratic. Why is that?
Yes, thank you very much. So COVID, during the COVID pandemic, it affected the economy generally. We had to have a lot of lockdowns. People had to stay at home so that we could control the spread of the pandemic. And during that period, donors were unable to move around freely. So during that period, there was a deep steep in our blood donation levels. And then last year, that's in 2023, 2024, we had another a reduction in the numbers of voluntary blood donors or numbers of blood donors generally. And people attributed it to the economy. I agreed it might be related to the economy because people will come out to donate blood, but they would not be eligible. Most of them is that their blood pressure level is very high and they needed to see a doctor, or the levels of their blood hemoglobin level is low. So highest reason for a temporary deferral during this period was because of reduction in the hemoglobin level, which was not optimal enough for them to donate blood. Right now, we are seeing an increase in the number of people donating blood again.
Right. What are agencies like yours doing to fundamentally change the mindset around giving blood?
Yes, we do a lot of advocacy. It isn't enough, but we do a lot of advocacy. One of the things we started in year 2021 was to join the rest of the world to make January our advocacy month. So in January, we go out a lot to talk to people about donating blood. We go to the markets, we go to the churches, we go to religious centers and schools to increase our advocacy. Also, because we just can't do it alone, we are partnering with a lot of non-governmental organizations and humanitarian organizations to talk to people about saving lives. Today, for example, we also had a stakeholders meeting, a training with nurses. And during this meeting, we talked to them on how to encourage the patients' relatives when they come around to donate blood. So we need to continue to talk about it. We collaborate and partner with other television television stations to talk about it. Also, we have a weekly program in a very vibrant radio station at the peak of the hour, that's between 4:30 and 5, where we also talk about safe blood. So the best thing to do is to continue to talk about voluntary blood donation. Please, you need to donate blood. We need to tell them why they donate blood. We have also had to call in recipients of blood donation to talk about what's happened to them before they were transfused with blood and how the blood transfusion has helped matters. So, you know, we are doing our best to change the mindset about what blood donation is and why blood donation must be a regular thing.
I have to ask you, is all this affecting healthcare? In other words, are patients in Nigeria getting the blood they need?
So I would like to use the World Health Organization mandate to answer that question. So the World Health Organization says that the amount of blood needed to care for a community should be blood donated by 1 to 2% of the community. If I use the estimated population value for Lagos State, for example, of 20 million to calculate our blood needs, you realize that our blood needs will be approximately 200,000. Right now, as at given 224 figures, we were able to collect about 130,000 units of blood. So it means that we have only been able to meet up with 65% of the needs that we have. So not everybody is getting all the blood that they need. Many people have suboptimal blood received, and then we gradually build up the blood. So we are beginning to add restrictive blood techniques, building up and using blood and patient blood management programs to help to build the blood of patients so that the need will reduce. So we are not meeting all the needs. We are not really meeting all the needs because the blood donation, as at now in Lagos State, about 65% of what is recommended that is donated by the World Health Organization.
65% doesn't sound like it's anywhere near where it needs to be. So the crass question that comes to mind, doctor, is are people dying because they're not getting the blood that they need?
Well, I would also like to say that it's possible that people might, for example, we need to look at, for example, first, second, and third delays in obstetric cases. There's a need for blood. The blood might not be in that particular facility, it might be in another facility. So it depends on the way you look at it. We try to meet up with all the blood needs. As I said, most people get suboptimal amounts of blood that they need at the time that they need it. There's always a blood bank somewhere where they can get blood in. There are very few reports of people not getting blood when they need it. Very, very few reports. There are more reports of people not having adequate amounts of blood when they need it. Also, in looking at this, we need to also look at the needs for components. When we talk about blood, it's not just red cells that we're talking about. We're talking about platelet concentrates. We're talking about people that need fresh frozen plasma. All these things are part of the blood that people need. And as I said, for each type of blood and blood components we're talking about, because of that needs, there's a percentage of people that might have their suboptimal needs met. Their needs met suboptimally. However, the blood transfusion service, with the 161 blood banks we have in Lagos State, does its best to meet up with every blood request that we have.
Okay. That's Dr. Bodurin Oshikemaya. Thank you, and all the best.
Thank you very much.
That's it for now. Be sure to check out our other stories on dw.com/Africa or, of course, on social media. We'll see you next time. Bye for now.